Okay, good day everyone. So welcome to this class. We're done already with our devotional. So this is the topic about cellular aberration, or for short, or other terms known as oncology nursing. So what do you expect with this class? So we'll be as I have said already in the course outline, we will be caring for patients who have cancer. What are the signs and symptoms of cancer? Basic medications about cancer, and the different approaches and discomforts that the patient is experiencing and your nursing care when we talk about cancer. So let's move on. Okay, so when we talk about cancer, during this discussion, we'd be talking about the prostate cancer or prostatic cancer, the breast cancer, cervix or uterine cancer, the ovary cancer, cancer of the stomach or gastric CA, liver or the liver cirrhosis or cancer of the liver. We have the colorectal kasi they're just adjunct and near to each other, colon and the rectum. We also have the thyroid, lungs or leukemia. Okay, so we would be subdividing this one with first the genitourinary or reproductive. Then we would be dividing next by gastrointestinal. And last but not the least, we have your specific. You might be asking, sir, why is there no brain? Okay. Brain cancer tsaka bone cancer. You would be discussing this too, especially when it comes to your neurological and orthopedic nursing. But we would be passing through with these types of cancer. So let's move on. Okay, so what is cancer? So cancer is not defined by the linguistics as yung parang bad gamer, nag-quit or nagre-rage quit. Kaya bigla na lang nagpapabigat. Hindi yun yung cancer na tinutukoy natin sa game. Hindi rin ito yung zodiac sign. This is not the zodiac sign that you would see in the net to see your fortune or your horoscope with. It's not that. So what is cancer? According to the book or to our references, it is the process that begins when an abnormal cell is transformed by a genetic mutation of the cellular DNA. For example, this is your normal cell. Later on, due to some risk factors or genetic modifications, it becomes weird or mutated. So this one is your cancer cell. Okay, so we would be studying how does a normal cell go from being normal to an abnormal cell. Okay, so take note when we talk about cancer, it's an abnormal cell. Sorry, let me underline it again. Abnormal cell transformed by a genetic mutation of the cellular DNA. So it involves your cellular DNA. Okay, so the prevalence or the incidence that it happens to people. Okay, when we talk about prevalence, it is the second leading cause of death in the US. Okay, it is seen in people older than 65 years old. Okay, and last but not the least, it has higher incidence in industrialized sectors. Okay, so what do we mean by industrialized sectors? This is the sectors or part of the world or cities which has high in advanced technology, or this one is the uprising sectors. Sir, what does that have to do with the prevalence? Usually, people in a very highly industrialized area are busy. They use instant noodles, they eat quick fix food, and they don't have time for parang organic preparation of food. And everything is instant and they're exposed to risk factors that are industrialized or chemically contributing in nature. Later, we'll be discussing that. Sir, you're just telling us the statistics in US. It does not apply here in the Philippines. Okay, according to some research, okay, or according to studies here in the Philippines, it's also the second leading cause of death here in the Philippines. Kasi Philippines is highly industrialized na din. Though we're not first world, but we have come to accustom with industrialized sectors. And as much as possible, our food that we eat also contributes it. So it's second from the heart disease that causes many deaths or mortalities here in the Philippines. Okay, that's according to a reference dated 2019. Okay, but things change kasi we are in COVID season, but references prior to COVID, it has been the second um, leading cause of death here in the Philippines. Okay, we move on to the next slide. We're talking about tumor. Okay, so sir, you might be asking, or you have something in the back of your head, sir, is having tumor predisposing the person to have cancer, or can we say that a person with tumor has cancer already? So the answer to that is no. Okay, so tumor does not equalize to cancer, but we have markers to see if that tumor is already cancer um, a cancer in the making. Okay, so we have two classifications. We have the benign and the malignant. Okay, so in layman's term, let me simplify this lecture for you. When we say benign, it is your non-cancer. Okay, so when we say it's just a benign tumor, it's not yet cancer. Okay, you have to make further test and monitor that tumor for it to be called a cancer itself. When we say malignant, this is your cancer cells. Cancer. Okay. So what's the difference with these two? Benign is aside from non-being cancer, this one is just localized. It does not spread. Okay. So the cells that are mutated or altered are just intact. Okay. And there's no growth or spread inside the body. When we say malignant, it is aggressively increasing in number and in size, and it is affecting more than the local area, so it spreads out. Okay, so that simplifies it. When we say benign tumor, it's non-cancerous, and when we say malignant tumor, it's cancerous. Okay, so that simplifies it. So we go to the connective tissues. When we say here is the tissue involvement, when we say connective tissues, it includes your fibrous, cartilage. Okay, usually those are your connective tissues, and they have their own names for itself. Okay, so take note when it has the word oma in the end. Okay, it is more of your benign. Okay, so when you see a diagnostic results ending with oma, okay, so let's just first focus on oma. You might say, sir, bakit yung sarcoma naman it ends with oma rin? So we'll get to that later on. Okay, so this one is usually ending with oma. No sar in sarcoma, not sarcoma. It's just oma. Okay, so you would be seeing here in the tables here. Oh, it's here pala. On the other side here, there. Okay, so it's more of the oma. Okay, so when we say sarcoma or for your malignant, it's usually ending with sarcoma. Okay. Okay, so let's go and let's tackle it one by one. Fibrous or your fibrous part of your tissues, it's from the root word itself, meaning fiber or fibro. Okay, so fibroma. Okay, it has oma in the last. Okay, that's for your benign fibroma, and for your malignant, you have fibrosarcoma. So same root word, the fibro is still there, and sarcoma is added. Okay, that's for your what do you call this, fibrous tissue. And when we say cartilage, okay, so you might say, sir, cartilagioma. No, it has a better term. Kumbaga, it has a proper name to it. Okay, for cartilage, it's chondro. Okay, so when you say chondro, it means your cartilage. Okay, so for your cartilage, it's chondroma for your benign, and you have chondrosarcoma for your malignant. Okay, again, for your cartilage, it's chondroma, and chondrosarcoma. Next one, I've discussed this earlier during the introduction and the first part of the slide. We have for the bone, diba? There are commercials for strengthening of the bone, yung anlin, diba? Usually for osteoporosis. When say osteo, it means bone, and then you add oma in the later part, it would be benign tumor on the bone. Okay, so you would be seeing that. Okay, osteoma. And then for cancerous or malignant tumor, we have osteosarcoma. Okay, for fat, take note, diba? If you forgot the root word for it, diba? When you say fat and you want to remove it, what do? Liposuction. So hence coming the word for the fat, meaning lipo. You just add oma in the end. It's lipoma for your benign. Okay. And then you have liposarcoma for your malignant. Okay. So we go on with the smooth muscles. Okay. For your smooth muscles, this is a little bit challenging to memorize or retain. We have your leiomyoma, leiomyoma for your benign, and then we have your leiomyosarcoma for your malignant. Okay. Okay. For your striated muscles, okay, you have your rhabdomyoma. Okay, rhabdomyoma. And then we have your rhabdomyosarcoma for your malignant. Okay. And then when it comes to the blood, usually, diba, hematologic, or diba, hemarate, diba, usually yung sa commercial, it talks about the blood. Okay. Hemangioma for your benign. Okay. And then hemangiosarcoma for your malignant. Okay. So let me just remove, and let me remove myself, and let us review the slides for you to get it and master it. Okay. So when the connective tissues is benign, it's usually ending in oma, and when the tissue or the tumor is cancerous or rapid in spreading, it is called sarcoma. So this one, for your fiber, you have your fibroma. For the benign, and for the malignant, you have fibrosarcoma. For the cartilage, you have your chondroma for your benign, and chondrosarcoma for your malignant. For your bone, you have osteosarcoma. Osteoma for your benign, and osteosarcoma for your malignant. For your fat, meaning your lipo, part of your body, you have your lipoma for the benign, and liposarcoma for your malignant. Okay, so for your smooth muscles, you have your leiomyoma for your benign, and leiomyosarcoma for your malignant. For your striated, you have your rhabdomyoma for your benign, and rhabdomyosarcoma for your malignant. Okay, for your blood vessels, you have your hemangioma. Okay, here you have your hemangioma, and you have your hemangiosarcoma. Okay, in the other side. Okay, we'll move on to the next slide. Okay, so remember this one. You might be asked by this one. Okay, so before we proceed, let me just make this clear as a part of your professional growth. Okay, so when you are reading diagnosis, especially while you are in a student nurse, or while you're still student nurses, and the relatives of the patient would ask you, because there would be tests done to the patient, and they would be asking you, is my relative having cancer? and you reading the diagnosis for the for the patient would know, diba? They have their impressions or but my tip for you is do not tell the diagnosis that ma'am, sir, your patient has this type of cancer. Let the doctor explain it, because as nurses, we're primarily there to take care of the patient, whatever the diagnosis and whatever the findings would be. We're not there to tell what the results of the patient will be, unless properly endorsed or the patient or the relative has already background to it. Kasi it's hard if you would be breaking the news. What if they get into the denial stage? We don't want the patient to be restless, anxious, and going to the steps of being angry, being depressed because of the result. So let proper authorities or let the doctor explain what he or she or the relative is having na diagnosis, because you don't want to be in boiling waters. So that's just a tip of advice. Okay, so let's just move on. Let me remove myself again from the slides. Okay, so here we go. We have here when we say lymphoid tissue. Okay, so this one, some of it have names for being benign, and some of it does not have for malignant. Okay, so you may be asking, sir, why does other tumor does not have any name for benign and does not have name for malignant? Okay, this is one of the reasons that it may have. First of all, some of the tumors are detected either early or late. Usually, if you would be detecting it in an early stage by simple diagnostics or test, it would be more of the benign tumor. But later, if it is just a metastasis of the original tumor to another organ or another um, systemic part of the body, usually it's on the late stage or it's diagnosed late, usually stage 3 or stage 4. That's why it's already malignant. So some of these tumors are early detected, and some of these tumors are already late in detection kasi they're just fast spreading. When we say cancer, sometimes it proliferates. When you say proliferates, it replicates itself and thrives and lives in your body, and then they generate fast. And then especially if you have active risk of developing cancer and it advances in a more and more state, you would be having, or you would be expecting the patient or the cancer to be spread out in the body in a short amount of time. Okay, so we have here the types. Okay, so let's go first for the lymphoid tissue. Okay, so when we say lymphoid tissue, it has a benign state, which they call infectious mononucleosis. Okay, that's for your lymphoid tissue. Infectious mononucleosis. It's like a spell in Harry Potter. It's a little bit, what they call this? Tongue twister. Infectious mononucleosis. Okay, so when we say that malignant stage of that, it would be our, let me just mark it. It would be our lymphosarcoma, or sometimes they call it lymphoma and other terms, depending on the stage and development. Okay, so you might be asking, sir, diba when you say earlier, it's if it ends with the oma, usually it's benign. Okay, so this is the case where in your oma, that's why it's another chart in the earlier part, and this one would be a little bit what we call this, a little bit challenging for you. But when it comes to lymphoma, it would be just diagnosed as active or non-active. Okay, so we have here lymphoma. Okay, lymphoma and lymphosarcoma. Okay, so for exam purposes, okay, we'll just be using lymphosarcoma in the options. Okay, so let me just clear it out for you guys. Okay, so for the plasma cells, there's no benign state or name for those tumors found in plasma cells. Okay, for late or malignant stage of the tumor, it's called multiple myeloma. Okay, rings a bell. Okay, di ba usually yan yung mga sakit ngayon ng mga celebrities and ano. Okay, and then for your leukocytes, okay, it doesn't have a benign state, therefore it goes directly to your malignant state, and we call it leukemia. Okay, That's what we call that. Okay, when we go to the nerve tissues, this has an early stage and later on it does not have a name. Usually nerve cells are called neuroma. We're back to the omos here again. Neuroma, it does not have an advanced state or malignant tumor. Sorry for that. If your nerve sheath would be affected, it would be neurolelioma. Okay, neurolelioma, that's your benign stage. And when you go to the malignant stage, it would be your neurogenic sarcoma. Okay. For your glial tissues, I mean, sorry. Okay, we don't have a benign state for it, but for malignant state, it would be your glioma. Okay. Okay, for early stage, for benign retinal, it's in your eyes usually. You have your, you don't have a benign state for it, but for your malignant state, you have your retinoblastoma. Okay. And when we go to the epithelial tissues, you have your squamous epithelium, or what we call your papilloma. Okay. And then you have your advanced stage or your malignant tumor as squamous carcinoma. For your glandular epithelium, you have your adenoma and you have your adenocarcinoma. Okay. Go to the next slide. Just familiarize with this one. We would be discussing more and more of this as we go on with the progress. So this is just introduction and classification of words and what type of nerves and tissues. Okay. Okay, so let's go to the pathophysiology. Okay. So you have your risk factors, which are these. First, you have your viruses and bacteria. So let's just say viruses and bacteria. So, sir, why does viruses and bacteria cause cancer? First of all, viruses or bacteria has the capacity to infect or alter the DNA of a cell. Like, di ba, yung COVID, usually, the body's under stress, you have low immunity, and viruses and bacteria takes the opportunity and advantage. They thrive in the cells, later on altering the structure of the cells. Therefore, when your DNA of the cells is altered by the viruses or bacteria, your normal cell later on becomes abnormal. Okay, abnormal. I'll just do it. And the abnormal cells multiply. So that's why virus and bacteria are risk factors for you, or for not for you. Let me knock on the door for that. Knock on wood for that. That causes the genetic transformation for the patient, therefore developing or giving him the risk to develop cancer. Okay, let's go to physical agents. Okay, so um, when we say physical agents, usually these are the stress and strain that the body is absorbing. Okay, so usually stress, pagod, super stress in work, less sleep, it could contribute in developing certain types of cancer. So those are your physical agents. Okay, usually these are your lifestyle. Physical. Okay, this one is your overstress, lack of sleep. You could categorize it there. Later, we'll be passing more and more of that. When we say chemical agents, these are your cancerous agents. Okay? So, they say that yung asbestos, di ba, chemical din yun. And some, what do you call this? They say that some substances in the deodorant has cancer, di ba? Some lotions has tendency to develop. Okay, so those special substances, I would not go in more to that, but later on, let us later on in some classes, we would be sharing, or we would be discussing agents that may cause cancer. Okay, so this is more of your chemical. components in products. Okay, so when we say genetic or familial factors, this one is your grandparents. For example, in your family tree, there are your uncles, grandparents who have developed cancer. Usually, genetics is passed down, so it has risk for developing cancer. Okay, so let me just cut here. Okay, sir, when you say risk factors, does it mean to tell me that if my parents has, I already have cancer? Okay, let me just clear on that. Okay, so for Filipinos, let me just be clear or anin lang natin, klaruhin lang natin tong factors na to. Kasi minsan pag sinabi nating risk factors, akala ng pasyente meron na siyang cancer kasi yung magulang niya. For foreigners, I'll just be translating this later on in English. Baka sabihin ng mga patient nyo na, ay may cancer yung nanay ko, may cancer yung uh, lolo't lola ko. Di sure naman na may cancer ako. So does that assure the patient na meron din siyang cancer? So the answer is, it increases the risk for him or her to have cancer, but it does not indicate that the patient or the one asking you has cancer already. Kasi it's just a risk factor. So having high risk factors on exposure to virus or bacteria, physical agent, chemical agent, plus your genetic and familial factors, usually the risk factor goes high in you or for your patient to develop cancer. Okay, so let's be clear on that. So, hindi porket lahat ng risk factors nasa kanya, may cancer na siya automatically. Pero usually, yun nga, yung probability mataas pag ganun. Kung nasa kanya lahat ng risk factors. Okay, so let's continue on. So, in the family or genes. Genetic. Okay. Yan. When we say dietary factors, some food contains high in carcinogen or carcinogen forming what do you call this, content or ingredients. Usually it's found in our favorites. Okay. Sino mahilig kumain ng sige, on ko muna yung camera ko. Taas ang kamay sino mahilig sa hotdog. Okay, taas ang kamay kung sino mahilig sa chicken na fried. Okay, sino yung mahilig sa mga processed food, tocino, longganisa. Okay? Hindi ko naman sinasabi na cancer generating siya, but it has carcinogenic what do you call this, agents in their content. So sabihin mo, sir, pag kumain ako ng isa, ibig sabihin magkaka-cancer ako. No. It doesn't mean na when you eat those food, it predisposes you or it lets you have cancer later on. But take note, if lagi mo siyang kinakain or if you're eating or consuming products which are processed, especially if it's charred, medyo sunog, okay? And then, usually meaty products, fatty products, okay? Those may be dietary factors or increases the risk for the patient to have cancer. Okay. So, sabihin mo nga, hindi ka nga mahilig sa noodles. Ay, sabihin natin kumakain ka ng noodles, pero araw-araw ka naman kumakain ng noodles. So, factor din yun. Okay. So, yan yung ano natin. And then, we have our hormonal agents. Kasi hormones changes the structure of the body or the chemical composition of the body. So, basically, if you have hormonal agent, it also goes hand in hand with chemical agent. Di ba? Nag-iiba-iba yung hormones ng ating katawan. Therefore, if hormones are shifting in a regular basis or peaks or decreases, it may also increase your risk in your patient's risk to having cancer. Okay. So, scary. Di ba? Magka-cancer. So, let's go on with the next one. Next slide. Okay, so we have here our clinical manifestations, okay, related to the system affected. Okay, clinical manifestations. Let me just break it down. First, let's just simplify this slide. Say, it's already in the simplified form, but let's simplify it further. Let me just remove my face again. Oh, sorry, it became my whole face. There we go. Sige. So, okay, so your clinical manifestations is dependent on two variables. Next, parang research. Okay. Usually, it's by system affected, and it has the degree of disruption. Okay, so we have these two. Okay, so why did I simplify or broken it down into system affect and then the degree of disruption? Okay, so for example, pardon me for my quick sketch. No, ulitin natin. Na-ok ako. Joke lang. Okay, yan. For example, ito yung tao. Yan. Okay, so when we say degree, kung ano siya, kung newly diagnosed siya ng CA. Okay, so yan na lang. So, usually, the manifestation depends, okay, on the system that is affected. For example, let's say that the patient has gastric. Ito kung waring chan. Sorry na sa sa drawing. So yan yung gastric kung wari yan sa chan. Okay. So it depends on the system. Pag sinabi nating system, this is part of your GI system. Therefore, what does your gastrointestinal system do? Okay? So, usually it affects your absorption of nutrients. Okay? Next one, breakdown of food. 'Di ba? Ang tiyan nyo, dyan nagre-release ng hydrochloric acid. Okay? Yan. So, dito muna tayo mag-focus sa GI. This is a concrete example. Okay? So, for example, the patient has gastrointestinal cancer or gastric cancer. Cancer sa tiyan. Okay, so for example, meron sila na-detect na, for example, the yellow part would be your cancer. May cancer siya dito sa tiyan. Malaki yung tumor na nakita sa tiyan niya nung sinilip. Okay? So, for example, there is cancer here. When the patient eats food, ang tanong, ma-absorb ba agad yung nutrients? Kasi let me just remind you again that another property of the cancer cells, usually ito yung normal cells, ito yung mga cancer cells nyo. Okay. Cancer cells. Usually, ang cancer, pag nag-grow na siya, tsaka dumami na siya, inaagawan niya ng nutrients yung mga normal cells nyo. So, may mga normal cells pa naman din yan, pero na-outnumber na sila. Instead, yung mga nutrients, for example, yung nutrients dapat pupuntahan sa, for the foreigners, usually the nutrients must go directly to your normal cells, okay? But when you have cancer, or the patient has cancer, those nutrients would be grabbed or distributed pa to your cancer cells. That's why, cancer cells grow faster than your normal cells because altered na talaga yung genetics nila, and they thrive on the food which is intended initially for your normal cells. So, back to the question, is there normal absorption of nutrients when you have cancer cells? Yes or no? Definitely no. There's abnormal absorption of nutrients. And then, does your food break down in a normal way? Syempre, there would be no breakdown of food since your gastrointestinal area is already affected. Okay. So, when question class, if there is no proper absorption of nutrients and food is not breakdown properly, definitely yung patient nyo ba magiging masigla ba siya or matamlay? So, syempre, matamlay. So, matik, kaya siya nakalagay din dito. Or for general purposes, kasi yun nga, having this method of the cancer cells grabbing nutrients intended for the normal cells, usually it causes the patient to be anemic. Okay? Anemia, a person with anemia, person has weakness since the nutrients and the proper energy of the body is depleted or is being with complete competition dahil dun sa mga cancer cells nyo. Definitely, if pangit yung absorption of nutrients mo and food is not breakdown properly, the patient has weight loss. Okay? And then later on, sige, in the late part kasi kaya that's why it has opened in the late part here. This tumor grows more and more. It pushes our other organs and affects it. Or sometimes this cancer are so what do you call this? So aggressive that it breaks the barrier or it causes opening in your gastrointestinal system. So there, usually the gastric acid or other elements would be seeping out of that compartment of your gastrointestinal system. It would burst, therefore it would cause irritation of the area. Therefore, the patient would be also experiencing pain. But usually, this is often what they call this, often found in the later part or late stages of cancer. So, ang hirap, di ba? Those are the things that you would be seeing in the patient who is diagnosed with cancer or in the early part and sometimes in the most advanced part of what they call this, of cancer. Okay? So, those are the things that you have to watch out for it. Okay? So, usually, yan, system affect. What if, sir, sa brain naman, may tumor siya sa brain. So, usually, yung neurological functions, yung may problema mo. Usually, nagsisseizure. Kasi, excuse me, usually, nagsisseizure yung patient, nakakalimot, nagpa-pass out kasi na-impede nung tumor yung oxygenation sa brain mo. So, usually, may mga ganito rin siya na ano. Pero generally, yung mga clinical manifestations is, tandaan nyo lang, AWWP, anemia, weakness, weight loss, and pain. Usually, yan yung clinical manifestations. Nakikita more on sa ano. Okay, so let me go again to the degree of disruption. Okay. Yun nga, yung sa size, di ba? Yun yung sinasabi ko. So, for example, yung tumor maliit lang. Initially, hindi yan napapansin. Napapansin yan pag yun nga, sumusuka na ng dugo kasi malaki na yung ano, parang feeling niya lagi siyang bloated kasi nako-compress na niya yung abdominal area. Usually, yun yung degree of disruption mo. Pag maliit pa yung tumor, hindi mo pa siya mapapansin, pero pag habang lumalaki yung tumor at naapektuhan yung ano or it affects the local area or organ, then you would see the degree of disruption to that GI system, to that brain function, to that reproductive system that would develop cancer. So we would be streamlining that in our lessons later on. Okay, let's move on to the next. Okay, so these are the next slide. Okay, it loads. Then here it is. So here are the clinical manifestations for cancer. Okay, so first of all, let me just draw for you to remember. Let me just draw again. Drawing tayo. Dito lang tayo nag-excel. Okay, so yan. Sorry na sa mapanglait na ano. Yan, kuwari malaking kamay. Yan. Okay. So, ito si ano natin. Okay. Let's go to specific clinical manifestations. Yun kanina, parang generalized manifestations. Let's go to the specific manifestations for your people having cancer. Okay. So, we have caution me. So, caution us. Okay. Tandaan nyo siya. Caution us. Okay, yung kanina, AWWP, anemia, weakness, weight loss, tsaka pain. This one is more of the broad manifestations for patients having cancer. These are the things that you have to watch out. Okay? So first of all, we have the change in, Okay, let's go back. We have the change in bowel and bladder habits. Okay. So, bowel and bladder habits. Mag-drawing si Sir na naman ng kaanohan. Okay, so ito yung tiyan, ito yung intestine, mabilisan. Ayan, dyan yung rectum mo. Rectum nung patient. Okay, let me just represent the kidneys. Here are the kidneys, here is the bladder. Tapos ito yung urinary tract natin. Okay, the blue represents the urinary tract and the red represents your bowel system. Okay, so sige, para yon, para mas legit. Okay, so when we say bowel changes, when we say bowel, it usually concerns your large intestine. Okay, when we say bowel, it's your large intestine, the lining of your large intestine starting towards the end. Okay, so when we say your bladder, usually it's your container of your urine. Okay, so for example, there is tumor or growth here. What do you think would happen? So, di ba, dapat yung bowel mo is clear. Clear yan from obstruction in order for the waste materials to go out. Ano sa tingin nyo yung mangyayari kung meron siyang harang dito na tumor? Okay? So, definitely, your bowel or your peristalsis, bowel movement, or your peristalsis, what we call, would be decreased due to this obstruction. Diba, pag kayo nga, if you're riding or commuting, tapos may inaayos na kalsada, biglang road narrowing, usually nagta-traffic dun sa bottleneck na yun or dun sa inaayos na kalsada, part ng road. Okay, so it's true with this one. So instead of the waste materials going through, it would just stay here and get impacted. Okay, so for example, violet is your waste material. It just gets impacted there. So usually, there would be decrease in your bowel movement. Okay, so sudden change. Sabihin ng patient, medyo once in 3 days lang ako nagpapass ng aking stool or bowel or ng feces. Okay, so that's one. And then your bladder habits. For example, yung bladder ay may dito, cancer dito sa sa area na yan, sa bladder na yan, or minsan nagko-compress talaga dun sa So tingin nyo anong magiging So decrease din. So may changes yan. Dati ang lakas ko po umihi, or before I was really urinating a lot, but now it's just a little, or sometimes I feel the urgency of using the bathroom always, but just small amounts. So meron kang so nagdi-decrease yung urine output mo, plus yung function ng bladder mo is naapektuhan din siya. So it's either, or worst case scenario, katulad din ng example ko kanina, nasira yung na perforate or nabutas nung cancer yung inyong gut or yung bladder. Usually may mga blood vessels na malapit, since perforate or nag-burst yung wall and area, magkakaroon ka ng either extra extracellular fluids na lilipat. So it's either meron kang dugo sa iyong dumi or sa dumi ng patient, or dugo sa pag-ihi. So when we say hematuria, that's your bleeding in your urine, and when you have dark tarry stool, okay, or changes or blood in your stool, okay, that's another thing to consider, especially if there's no hemorrhoids. Okay, so yan, you have to, one of the clinical manifestations. So yan, letter pa lang tayo, C pa lang tayo. Okay, when we say a sore that does not heal, okay, so when we say sore, usually ang first na pumapasok sa isip nyo is sore throat. So yan, laging garalgal ang boses na matagal na. So more than, chronic na siya. So more than 6 months. Okay. Or more than 3 months yan usually. Yan. Na hindi siya nag-i-improve or palagi na lang din siyang ganyan. Or for example, meron kang sore na meron kang sore sa tuhod, o kaya sore sa tiyan, okay, na hindi nag-heal, yan. Possibly a clinical manifestation. Again, having one or more of these manifestations does not mean na meron talagang cancer yung patient. You have to do further testing. Again, huwag nyo sasabihin or lolokohin yung kamag-anak nyo na don't jokingly do this. Oh, you have changes in your bladder. You have a sore throat that does not heal. You have your bleeding that is unusual. Okay? Then I think you have cancer. Don't do that to your relatives. It will just give them stress. Instead, encourage them to get checked sa specialist, find out what's wrong. Kasi sometimes, di ba, elderly or people having this one would have different causes. Hindi lang naman cancer ang nagkukos nito lahat-lahat. So usually, multifactorial yan. So you have to encourage them to get checked and screened for cancer. So it doesn't mean that if you have one or more, it means that your patient already have cancer. Okay? So you have to think outside of the box, and don't use this as threat to your relatives or your friends. Okay, next one is unusual bleeding or discharge, and like what I've said in the bladder, you have your bloody urine and bloody stool. Okay, so sorry for this one if it looks disturbing. Okay, or for example, na dapa or nasugatan. He got wounded in the knee and it's always bleeding. There's unusual bleeding or discharge. It's another cause or another clinical manifestation. Okay, for ladies. Okay. Example, yan. Ano yung ano natin? For example, there's lumps on the breast area. There's thickening. When you compare it in the other side, it's not like that. So there's thickening or unusual lump elsewhere. So that may be an indicative clinical manifestation. Okay, so that's why ladies are encouraged to self-breast examination. Okay, so unahan ko na kayo. Let me cut you in advance, sir. Is there a chance that guys have developed breast cancer? So there are studies or parang there are journals that says that it's also a possibility for males, but predominantly breast cancer are for females talaga kasi mas pronounced, plus yung chemical what do you call this, hormonal and chemical composition ng ladies nag-iiba siya after menopause usually. Okay, so yun lang din. Whereas early, do early check to avoid and prevent. Okay, so next one. Let's go to indigestion or difficulty in swallowing. Okay, so for example, you have tumor or mass or lumps here. Therefore, giving the patient dysphagia or difficulty of swallowing. Okay, tapos sometimes see if it's more of indigestion, usually it's in gastric in origin or the small intestine spread. Okay. So, hindi natutunawan. Therefore, the breakdown of food is not good because there is cancer in that specific area of your GI tract, therefore giving you indigestion. Okay, another thing. Obvious changes in wart or mole. So, for example, may nunal siya dati na maliit, tapos bigla yung lumalaki. Okay? It might indicate types of skin cancer. So, usually, it gets checked and biopsy. Okay? Next one is nagging cough or hoarseness. Okay? So, nagging cough, yun na lang yung ubo ng ubo na walang rason. Hindi naman siya yung allergy cough. Hindi naman din siya yung COVID cough. Okay? So, nagging cough is tuloy-tuloy. Kasi di ba pag sinabi nating nagging, it's non-stop. So there's a expression that stop nagging me. So nagging means excessive, repetitive, and continuous cough. Okay? And then hoarseness, this is more of the voice, garal-gal ang boses, yung palaging paos, yung parang palaging nag-concert. Yan. So hoarseness, medyo garal-gal ang boses. Okay, so you have here, aside from what we have described earlier, dun sa general manifestations, You have your unexplained anemia. Bigla na lang nanghina, naging lanta. Okay? And then, sudden unexplained weight loss, as what I've explained earlier. So, it does not need explanation. Okay, moving on to the next slide. Sorry, it jumps. Okay. So, for the diagnostic measures, okay, we have to screen. Okay, that's why I said detect early. So, early prevention or early diagnostics or early screening. Okay, so the keyword here is early detection. Okay, so this focuses let me read on this one. Cancers with highest incidence improve survival rates if diagnosed early. So, let me just put it on red because it's important. Early detection increases the chance of survival. Okay? Sir, why did you say that? Okay, so if you have already detected it early, you could treat the problem early. You could ask or do health teachings to modify the lifestyle. Okay, kasi 'di ba? When we say lifestyle, you have your physical aspect, you have your dietary factors, 'di ba? Those are modifiable. Change lifestyle. If ever your patient is predisposed in having or developing lung cancer and he is a chain smoker, you ask him or her to modify his or her lifestyle. Okay, if your patient is eating a lot of processed foods, since it's still in the early phase, ask him or her to modify the lifestyle. Okay, so that's what's good about it. If you detect it early, it increases the chances of survival. Okay, so what are the purpose? Purpose number one, it determines the presence extent of the tumor, what I have said earlier. Kumalat na ba siya at saka gaano siya kalaki? Okay? And next one, it would identify the possible spread. Okay, when we say spread, yun nga, metastasis. Yan yung nagala, or sorry for the term for the foreigners, if there are foreigners here in this class, but I guess there's none. Kung nagala yung cancer sa iba't ibang paligid at mga karatig na ng mga organs or system, makikita natin yan. Okay? So, is there invasion in other body tissues or spread? So, usually it's metastasis. Okay? So, next one is we would evaluate the functions involved and uninvolved in that bodily system or organ. For example, yun nga, sabihin na natin may prostatic CA. Is the urinary or yung pag-ihiba ng pasyente is apektado? Or ano ba siya? For example, gastric or lung, nahihirapan ba yung huminga yung pasyente? At ano ba yung mga steps na gagawin natin since early pa lang yung detection, or ano na yung gagawin natin kasi late na yung detection natin. And then last is obtain safe tissue and cells for analysis, including tumor stage and grade. Okay. So this one is what you call your diagnostics, laboratory test, and biopsy. Okay. So this would be the last part for this one. Okay. So we have here our diagnostic test. We have our tumor marker identification. It's self-explanatory. It would locate where the tumor is and identify on what size it would be. Another diagnostic test would be your genetic profiling. Are you predisposed, or is your cells prone in having cancer, or if there is, what type? Okay. You have your imaging studies. Usually, it would be the first line. Parang makikita na, don't you know that some of the cancers are discovered accidentally? Especially if the doctor would request parang chest x-ray, makikita lang nila na parang, oh, but may tumor or there's nodule here in the lungs. For example, the doctor would order CT scan of or ultrasound of the upper abdomen or lower abdomen. Accidentally, sometimes they find it through imaging studies. That pero later they would be you would be seeing it in laboratory results or diagnostic results that further tests are needed to be done for confirmation or diagnosis. Kasi not there and then you would be diagnosed with cancer. Usually it asks and it would take the opinion for other testing to be done there for further studies in order to identify if it is cancer or not. And last but not the least, biopsy. This one is, for example, they would be doing an operation in a certain area for tumor, and they would be testing the biopsy for it to determine if it's benign or malignant. Okay. So let's just end the first part here. I'm almost 1 hour talking. So with this one, I would be expecting you to be present in our class or wait for further announcements for the part 2 of this lecture. Thank you very much for listening and have a nice day.